So our COVID infection numbers and our deaths are coming down significantly. This, of course, is really great news. But at the same time, South Africa remains on the United Kingdom's red list. And today, South African scientists have been engaging with their UK counterparts on this issue. The British High Commission says while there are a very small number of beta variant cases in South Africa, it remains a concern given its potential ability to circumvent vaccines. Well, let's speak now to Professor Tulio de Oliveira, Director of the KwaZulu Natal Innovation and Sequencing Platform, KRISP. Prof, thank you very much for your time. I know that you're part of the team of South African scientists who've been engaging with your UK counterparts. How's that meeting gone today? Are you able to give us more details?
Okay. Yeah. Good evening, Sally, and good evening to all your viewers. Yeah. Yeah. So today we had a meeting. Yeah, with UK scientists and also the High Commission. Yeah. And was a very positive meeting. Yeah. And details of this meeting will come either later today or tomorrow by our official statement of the National Department of Health and the UK. So the importance of that is to have a line of communication where we really focus on the data, yeah, and really try to be transparent with the data and use data to guide policy. Yeah.
Absolutely, and that is so crucial and has been all through this pandemic. Something that the British High Commission, when they released their statement just over a week ago, they said that they were concerned about, while there were only small numbers of the beta variant, which of course was first discovered here in South Africa, while there were only small numbers, they were concerned about its potential ability to circumvent vaccines. So first off, can the beta variant circumvent COVID vaccines?
Okay, thank you. Thanks, Sally. It's a very important question. The first answer is that the beta variant seem to have disappear. Just to get idea, the last time that we identified the beta variant was in the first week of August. Yeah. And since then, as the Network for Genomic Surveillance, we have done over 1,500 genomes all across South Africa, and we could not detect this variant again. And even when we detect in beginning of August, it was in less than 1% of the samples. So it really seemed to have really been disappear. Why such a variant would decrease on so much in prevalence? And that were results that we published last Thursday night, yeah, as the Network for Genomic Surveillance, that show that the Delta variant is around 50% more transmissible than the Beta. So basically, the Delta variants win the competition and took over in the whole country, and that's what caused the third wave. Yeah. In relationship to the Beta to circumvent vaccines, what we know is that some vaccines were less strong against the Beta than others, and that was very important information to us in South Africa to select our vaccines that we are using now, both the Pfizer and the Johnson & Johnson, because we did have data that these vaccines were very effective against the Beta variant. What I'm saying, I'm not saying that the other vaccines are not effective. We still believe that the other vaccines are also very effective to avoid the hospitalization, and that even with the Beta, but it wasn't that we didn't have that kind of data in South Africa. And what we have tried in South Africa in the COVID pandemic is to use data to guide the decisions. Yeah.
Yeah. So what I'm hearing from you is that the Beta variant has basically been obliterated by Delta, which is 50% more infectious. But when the ability to circumvent the vaccines, the Beta, it is able to do it in certain vaccines. But if you compare it to the Delta's ability to circumvent vaccines, which is the more concerning variant?
So in relationship to the vaccines, the more concerned variant would be a little bit slightly what is the Beta and then the Gamma in Brazil or the Lambda. Yeah, but again, the vaccines are still effective against hospitalization and disease, even with these variants. Yeah, and the Delta is really adapted for transmission much quicker, and that's why it took over in South Africa and everywhere in the world. And on the Delta variant, the vaccines are very effective, and that's why the UK and other countries in the world. Yeah, for example, the United States has left the travel ban to South Africa, as many countries in the European Union, such as Germany, France, because at the moment the whole world is basically dominated by one variant, that's the Delta, which the vaccines work very well.
All right, so if I had to sum it up and I ask you, in your view, as a scientist, is the UK's concern about the beta variant at all justified? Yes or no?
And that's again my personal opinion as a scientist. At the moment, in the last couple of weeks, no, the concern is not valid. Potentially 2, 3, 4 months ago, yes, that was a relatively valid concern. And that's the importance of keeping generating very accurate and recent data. So, for example, our most recent genomes from South Africa, that's in the public database, they were sampled on 14th of September. And we are really decreasing a lot of the time frame between sampling and release of the data. So what we know that at present, the concern about the beta is not valid, not only in South Africa, but also in other Southern African countries. Mm-hmm. So, for example, in the SADC region, we have 8 countries that have recent genomic data, and in every single of these 8 countries, right, the Delta overtook the beta.
So it's basically the information is outdated. Is it a case that the UK scientists were not up to speed, or do you think that perhaps they passed this information on and the politicians took a different decision?
So I wouldn't like to speculate of that. One thing that we learn about the UK system is that normally they reevaluate every 3 weeks, and normally they provide data like at least a week or 2 before the evaluation panel. So a lot of times it's just a time delay that maybe the data provided for the last evaluation was potentially weeks old, but we think that now the time delay should decrease, and that's why it's important meeting direct with the scientists and the High Commission. And I believe that both our National Department of Health and the UK will release our official release about that meeting, which was positive. And what we are doing in South Africa is strengthening the testing, genomic surveillance, and make sure that the data can guide the decisions, not only in South Africa, but everywhere that impact South Africa.
Well, that is potentially very good news. Thank you very much, Professor Tulio de Oliveira, Director of the KwaZulu Natal Innovation and Sequencing Platform, KRISP. And he is telling us he was part of that UK-SA scientists meeting. Positive meeting. Expect news from that meeting either later today from the Department of Health or sometime tomorrow.